audible correctly? I'm not putting the headphones.
You're very, very, very clearly
Oh,
audible.
so to theek hai, chalo. So I'm not putting
Yeah.
it.
So before we begin and before Dr. Rujita sets up the slide, I will just give a very, very brief introduction. Of course, I'm sure many of you have met Dr. Rujita, but for those who have not, Dr. Rujita is one of our consultant dermatologists at Sir H.N. Reliance Foundation Hospital. And I must tell you that, of course, her clinical acumen aside, she is a wonderful, wonderful clinician. Because many a times what happens is that when we talk about skin, when we talk about aesthetics, a lot of people think, okay, ye to sab upar ki baat hai. These are all vain things. But as a psychologist, I understand that how much of an impact it has on an individual in their cancer recovery, in their journey, and kitna zyada wo ek impactful factor hota hai hamare liye. And to find a clinician who resonates with this idea has been a difficult task, and we are very lucky to have found Dr. Rujita for the same. She is somebody that is excellent at what she does. She is somebody who has been very, very on point with our whole holistic approach towards well being with her support group. And I think one of the most important things as a person, I would say, is कि एक डॉक्टर कितना अच्छा है जब हम ये कह सकते हैं कि नहीं, आई विल टेक माय फैमिली मेंबर to them. So I think Dr. Rujita has seen majority of my family, majority of my friends over the years, and we're so happy to have her today with us for our support group. So over to you, Doctor.
Thank you so much, dear, for that wonderful introduction. It made my day. Okay. So I'm trying to share here, Mezabi, and it says the host has not allowed sharing as of now.
Dr. Rujita, I've just allowed slide share
Okay.
and thank you very much for taking your time. Welcome. I just want to remind everyone that a few years earlier जब डॉक्टर रुजुता को हमने ग्रुप पे बुलाया था यहाँ पे एक लेक्चर देने के लिए वहाँ से एक बहुत ही अच्छी शुरुआत हुई। उसके बाद हमने ऑन्को डमैट इनिशिएटिव चालू किया जिससे अभी बहुत सारे पेशेंट्स को बेनिफिट हो रहा है कि जिसमें डॉक्टर रुजुता जो रेडिएशन से रिलेटेड साइड इफेक्ट्स हैं स्किन के ऊपर उसको क्लोजली मॉनिटर करती हैं, ट्रीट करती हैं। So we are very thankful to Dr. Rujita for first taking the time out and also looking after the patients and making them feel better. Over to you, Dr. Rujita.
Thank you so much, dear
The other
Prasad.
thing is I'm also recording this on YouTube. So जो लोग अभी join नहीं कर पा रहे हैं वो इसको YouTube पे बाद में हम देख सकते हैं इसको।
Yes. So thank you, dear Prasad, for the. So Dr. Prasad and Mezabin both are really very kind with their words, very generous in
And very
their,
honest as well, huh? Very
so
honest as
it
well.
gives me a good feeling. Okay, so today we are going to be discussing about how the skin care happens through cancer recovery and a few notes about monsoon wellness because that's what we are now going through the monsoon at its peak with all its nice sceneries that we can see उसके साथ ही बड़े problems भी आते हैं तो a little note about that too कि how we could combat the skin problems which could arise out of monsoon in general also but more so when our patients are going through so much of therapies, they're stepping out every single day in the water and through the rains to reach here. So that also carries its share of monsoon related minor skin problems. So we will be looking at them also. So we will be talking about the effects of radiotherapy on skin, hair, nails, post radiotherapy, long-term care, what we need to do, and as I said, a little note on monsoon infections. So how does the radiation therapy affect on the skin? So we have to see here, this layer which is going up and down is the basal layer of the skin. Now this is a layer which is the birthing layer. It births new skin cells and tries to replenish them when they die because of natural wear and tear. So imagine now this natural wear and tear is compounded, मतलब ज़्यादा हो रहा है. Why? Because of this radiation. The cells are dying because of the radiation Why? Because all radiation does is, rather all cancer therapy does is टारगेट द एक्सट्रीमली डिवाइडिंग सेल्स जो ज़्यादा डिवाइड होते हैं बॉडी में, जैसे कि कैंसर सेल्स हैं और उसके साथ स्किन एंड हेयर भी, बिकॉज दोज आर ऑल्सो रैपिडली डिवाइडिंग सेल्स कि रोज के रोज नए सेल्स बन रहे हैं. और ऐसा जब नहीं होता, रेडिएशन के वजह से रोज के रोज हमारे नए सेल्स नहीं बनते, तो देर इज अ डिफरेंस इन द बैलेंस बिगड़ जाता है बिटवीन द going off out of the cells and rebirthing. So because of this, we may have some effects on the skin. So that is the basis of radiation therapy on the skin. अब क्या होता है? What changes can I see during the radiation on my skin? So these above the line are the changes we see, and below the line are what you may feel. So there is dryness in the skin. There could be a little dark discoloration. There is redness and peeling. Dryness is generally what happens to everyone, but dark pigmentation is mostly because all Indians are inherently, programmed कि हमारा डार्कनिंग होता है विथ वॉट एवर वी हैव, जले कटे दर्द हो लग जाए, वट एवर वी वट एवर लिटिल इंसल्ट्स दैट द स्किन अंडरगोज, डार्कन is a universal problem of brown skin people, let me call it. थोड़ा सा redness when there is inflammation, because sometimes radiation can induce a little inflammation in the skin, and sometimes peeling. जैसे वो darkened skin के बाद में क्या होता है, we kind of that skin gets left out, so that results in peeling. Now what you may feel is a little itching, burning, sometimes a sense of pull from within, and a little junjunahat, we call it, pins and needles sensation. Now we have to remember one thing, that all of this will not happen in all the patients. Some of them do not have anything of this, and some people will have all of this. Also, when it comes to these four sensations, these are the four most common sensations what people have told me. But every patient, the skin differs, the tolerance differs. For some, if a 2% burning is too much, for others it must be nothing. So it all depends on the individual tolerance levels and the individual skin differences also. But this is one of the commonest things that you could see. Now, how do we take care of the skin during the radiation? Skin hygiene is very important. Of course it is. You are stepping out of the house, you're coming daily here. So at least once a day, it has to be cleansed thoroughly. Now, generally, we do tend to give some creams to protect the skin, prevent any problems, and if there are minor problems, to treat them also. तो ये सब जब क्रीम्स के लेयर्स लगते हैं स्किन पे, तो they should be removed properly also. Also, our radiation, the first foremost point which everybody will tell you is, when you come for the radiation, the skin should be absolutely clean and dry. तो उस हिसाब से भी the hygiene is important. Of course, when I say hygiene, it's not important that you wash 5-6 times a day. In fact, that's what we don't want you to do, because more handling we kind of disallow. Skin is becoming a little gentle, it is becoming a little susceptible, थोड़ी नाजुक सी हो रही है, ये हमको समझना चाहिए पूरे रेडिएशन के दौरान. तो जैसे एक बेबी को हम ट्रीट करते हैं, वी डोंट रियली बहुत ज़्यादा उसको हैंडल नहीं करते, केयरफुली जेंटली करते हैं, वैसे ही हम हमारी रेडिएटेड स्किन से भी बिहेव करना है. जो भी we use our clothes have to be selected very very carefully. There can be nothing in contact with the skin there which is rough in texture, which may not be comfortable. टाइट हो रहा है अगर थोड़ा, अगर चेस्ट का रेडिएशन है तो टाइट क्लोथ्स इज नॉट अलाउड. अगर किसी भी और बॉडी पार्ट का रेडिएशन है तो वहाँ पे जैसे कुछ कंटिन्यूसली अगर रब हो रहा है, फ्रिक्शन हो रही है, तो दैट इज़ नॉट अलाउड. जैसे अगर हेड फेस नेक का हो रहा है तो नथिंग अराउंड द नेक, जैसे कोई चेन है या कोई समटाइम्स दे गिव टू office में we wear those batches, so nothing which can rub against the skin. So इसीलिए loose soft clothes are preferred. In fact, so much so that sometimes the fabric selected is perfect. It's cotton, soft या muslin या softer than that. But जो डालने की जो process है उसमें the t-shirt has such a small neck that it kinds of abrades throughout. So that's also not allowed. So you have to look at both the things, loose clothes and soft clothes. What about fragrances? Now, fragrances are believed to make you more radio sensitive. जैसे अगर fragrances के साथ एक person जाता है तो radiation को ज़्यादा sensitive हो जाता है rather than without fragrances. So as a blanket thing for everyone, it's better to be cautious. We try to avoid all type of fragrances. This includes deos, perfumes, body mists, any overly fragrant body washes. Okay. Now, as I said, friction and massage of the skin are supposed to be avoided. Then how do we apply the creams if we are prescribed? So the way to apply is gentle application, one stroke. You apply, leave it. Sometimes yahan ka yahan leke we kind of try to massage, so that is not allowed. So always remember, be gentle when handling the skin and applying the products. Okay. So what about washing yourself? Because washing में क्या होता है कि we need to use something. We need to use the soap or the body wash. So उसमें what we generally recommend is वो जो lather होता है, you work up the lather on your palms, not on your radiated skin, because generally the tendency is to take the bath or take a little body wash with the pump and then work up a lather on the skin. No, that's not allowed on radiated skin. You will have to work up the lather on your palms, and then with a gentle circular motion, you can kind of clean that radiated area so that there is a thick layer of the lather between your two skins. So that will reduce the friction. Now, there are some patients who ask me, okay, rather than doing all this, doctor, let me not use the soap. I'll just put water and come. But again, the applied creams will not come off. Chalo, if some patients are not using the creams for some reasons, let's say their skin is not dry and they feel like, waiting till the problem sets in and then we give. So there are personal choices regarding this, and we do, honor them if the skin looks normal to us. So in such cases also, the very fact that they are sweating, it's India, always that it's never going to be very cold and pleasant all the time. So we are going to sweat every single day. They are going to be moving around in the hospital, coming out of their house, going back. So hygiene is also important. So that once a day washing as recommended is required. Do not try to avoid cleansing products totally. Whatever is allowed within that confines of non-fragrant, non-colored and moisturizer based products, we can sort of experiment a little. If some people don't like a certain product prescribed by us, they can go for something else and we can suggest them a few other products, but that once a day cleansing is a must. Okay. Now, once we are done with the cleansing and the bathing, drying that area is also important, but also not drying with a sort of a towel which can abrade that thing. Like the usual Turkish towels that we use are kind of rough, so we suggest them to use very soft cotton towels which are very smooth in texture, so that it can be patted dry. Patting dry is always important. Now, sometimes I do mention to my patients that if it is the face area, forget about it, don't dry the part. But then they have to take their time to at least air it so that it dries. In any case, moisture is not allowed in a country like India, where fungal infections can just come up like this, more so in monsoons. So we have to see to it that the area is dry. Now, if the radiated area has folds, like if it is the breast area, then below the breast, armpits, if it is the neck area, then maybe the neck folds, these have to be definitely kept moisture free. So you may use a soft towel to, sort of pat that area dry. This ensures that there is no moisture, which will help us be away from fungal infections. Also, there will be no friction. A dry area generally gives that skin slip. Moisture will give that friction. So that's also important, where we keep it moisture free, friction free. Okay. Of course, it helps the bacterial and fungal infections to, take a kind of a footing in that area. तो अगर हम ड्राई रखते हैं किसी भी फोल्ड को, तो हम बैक्टीरियल और फंगल इन्फेक्शन से बच सकते हैं. So can I prepare my skin for radiation? Yes. Like if I know that my radiation is going to be starting from next week, what can I do in this week to help me get through the radiation better? So pehle to you start hydrating, because as I said, all radiations will dry the skin up a bit, and it's a good habit to hydrate in all of the people, irrespective of whether they are patients or not. So one moisturizer can be used. It may be anything which may shift to a non-fragrant or something we give you later. But for the time being, you can just pick up any moisturizer and use it twice a day so that the skin starts getting supple. Adequate water intake, because that goes a long way in maintaining the hydration of your skin. Also, water will flush out. It is said that it flushes out the extra toxins in the body, so obviously it's a good agent. So hydrate yourself from the outside and from the inside. Avoid spas and massages directly to the would-be radiation site, because we wouldn't know the products. You may have gone to the same spa, done the same massage a lot of times before, but we don't know if they use a new product this time, which may, you may be allergic to to the product, and then we wouldn't know. So we don't want to have any unnecessary problems right before the radiation therapy. Also, in a lot of cases, the radiation happens after surgery plus or minus chemo. So in any case, that part is currently healing. So we would not like to touch it unnecessarily. Okay. Any new product or brand should not be tried in the run up to the radiation, even if it's for a week or a few days. No new product means anywhere on the skin. So no new shampoo, which is actually not related also. So no new shampoo, no new makeup products, because the same theory applies. If we are allergic to it, then we are unnecessarily creating an environment of inflammation in the body. Even if it is not exactly on that side, we don't want any inflammation in the other parts of the body too. And of course, avoid self-administered oral supplements, vitamins, because in general also throughout the radiation, we don't recommend vitamins with antioxidants, because radiation works on the principle of oxidation. So antioxidants will theoretically lessen the effect. It is not clean. There is no evidence as such, but we don't want to take chances when it comes to radiotherapy. Whatever the doctor has advised, maybe the earlier surgeon or any other doctor, is okay to continue during the radiation, but we should not start anything new. Also, a small point about these vitamins: if they are taken for the first time, self-administered, they also, you must have noticed, all the vitamin tablets and capsules are colored. So you don't know, you may be allergic to one of the colors in the capsule or the tablet. So then again, we don't want to have any allergies, any inflammation before the radiation starts. So this is what you can do before the radiation starts. And then during the radiation, when it's ongoing, what happens? Generally, a dark sort of pigmentation happens, which may range from just a few shades darker to a little 5 to 6 shades darker, depending on the inherent color of the patient. It is said that fairer patients will not pigment much, and darker patients tend to pigment more. And of course, this comes back to normal without us doing anything. Even if the dermatologist doesn't interfere and doesn't give even one cream, it's supposed to come back to normal. But it will take its own sweet time. So sometimes, if the patient feels that, no doc, I want to get rid of this pigmentation faster, we can give additional anti-pigmenting cream, something which is safe post radiotherapy also, and in the long run also. And we can try and get back the color within a fewer weeks than it would have in its natural course. Then what happens to that dark color skin sometimes is we shed it off, like we would shed skin in the winter times, a little flaking. So this peeling happens either in bits, like little flakes come off, or they may happen in sheets, like a large piece of sheet comes out. Of course, this also normalizes within a month, and that's just body's way of getting rid of the dark dead layer of the skin. Okay. Now, sometimes these things happen, which are a little sort of technical here, by telangiectasia, which means easily seen blood vessels, let's call it. So light, thin, red colored lines may be seen. Or sometimes there's atrophy, means a little thinning of the skin. Sometimes there is a little sclerosis, which means toughening of the skin. The skin feels a little tighter. And keratosis. Keratosis means till. So till is basically what happens to every one of us. But let's say, what if a person is on a ship for 6 months, like on the sea outside, in the outside environment? So definitely those persons will get more tills. Something similar happens. So if there's a face involved, sometimes about 10 or 15 tills can come up. and these are called nevi. And various types of keratosis means all black colored sort of lesions which are benign totally, no problems in that, only cosmetic difference in the skin, and that can come up more after radiation. And in the long run, what can happen? It could give rise to a little thick skin, thick meaning a little tighter skin, which is called fibrosis, where there could be retraction. Like if it is the breast, the one breast might look a little smaller than the normal breast. There could be a sense of pull from inside. Of course, whatever we do, the creams we apply, the exercises we tell, the massages which are taught to you after the radiation are all to mitigate or counter all these changes. So if someone really follows the exercise massage routine properly, then they can avoid getting these changes. So what should be done after the radiation therapy, like immediately after, within the next week or so? So we should inspect yourself daily. What happens sometimes, it's the fold which sometimes people are not able to because of the weight or maybe a little obesity, or they don't look towards their folds so easily. And there are so many people who are late reactors, means throughout the radiation they will not have a problem, but let's say a week after the radiation, that's the first time they start getting the redness. So these are some late reactors, and we wouldn't know unless we get it. So nobody is a labeled late reactor or an early reactor. So you have to daily inspect yourself. Like if it is the breast, pull up your breast in the front of the mirror, look if there is a redness happening. Sometimes when the redness starts, there is no symptom also initially, and the symptoms only start about 24 to 48 hours when the patient starts feeling a little itch or burn there. So it's better to self-inspect yourself every day in all the folds around the radiation site. And whatever creams or ointments you've been given, sometimes it so happens that it's not time to stop them right after the radiation for various reasons. One is perhaps your skin was a little inflamed, which will take time to, get to normal after the radiation. Or sometimes pigmentation has started setting in, and then we need the same ointments to take care of that. And as I said, sometimes a late reaction may happen. So for all that, we tend to give a cover. And that cover is generally 7 to 15 weeks. So don't think that acha creams ointments abhi mera radiation ho gaya, so I will not use them. Use your doctor's advice to help you about how to go about stopping these creams. Because most of the times we use steroids in this cream, and there is a way to stop them. We can't stop steroids abruptly. Sometimes they have to be stopped after decreasing the dosage to maybe once a day or once in 2 days. Or sometimes when a heavy steroid is used, like a very strong steroid is used, we can't stop it abruptly. We have to step down to a mild steroid, then get out of it so that there are no side effects. When you see your skin peeling, don't try to remove it. Don't feel ki there is some gandagi here, let me just scrub it off. No, your skin will peel off normally when the lower skin, the new skin, your own skin is ready to face the outside world. Till then, that will not be separated. So what happens if you separate it prematurely? The lower skin will get exposed to the outside world earlier, prematurely. So it is not ready. Then it may again pigment, or it may again form that crust. So you have to wait for it to naturally separate. So what can we do till then if the skin is just peeling?
हॉस्पिटल से कोई वो रूम
We
के ऊपर बैठी होती
can, so we can help a smoother removal by moisturizing the skin regularly. That's what will help us a smoother and painless removal. Now, if you have been allergic to any products in the past, even if it's a 20-year back product that you had an allergy, this is common with some hair dyes. You are allergic to XYZ product. Do not use it. Even if that area is very, very far away from your area of allergy. Still, we don't use known allergens, we call them. Known allergens in a person are never to be reused, more so post-radiation. And sometimes it so happens ki again mera radiation ho gaya, now I want to wear all that I want to wear. I have to go to a party, there is a function, there's a wedding. We can understand, and we have ways to go about that also. Over the years we have worked out a lot of cheat days and cheat sheets, as we call it, how to go about it. But do not think that okay, abhi mera radiation ho gaya, ab main jo pehnu kya farak padta hai. No, as I said, 15 days post radiation you have to behave in the same way as you were doing throughout radiation. That's our cover period for late reactors. And you wouldn't know whether you are a late reactor unless we have the problem. So it's better to continue following all the do's and don'ts for the next 15 days. Now let's come to hair. Now hair, generally chemo related hair loss, we all know that it goes off as a whole from the scalp, from the body, the eyebrows, eyelashes, and then it comes back. Radiation related hair loss, what happens? It happens only on that particular area of radiation. So nobody is going to lose their hair on the scalp if the radiation is given on the breast or face. If the patient is receiving radiation on the face, the beard may be lost, but again, only in that specific area. Now, it all depends on the dose of radiation also and the individual patient characteristics also, that how far temporary or permanent the hair loss would be. So after the radiation has been done and the hair have been lost, there are ways and means to get them back with a little support from hair tonics or hair growth regrowth serums or hair vitamins. Of course, after leaving that window period of 15 days, then we can start all these medicines. And there have been cases where the entire hair growth has come back. Of course, you have to accept one thing, that even post chemo or post radiation, whatever the hair comes, that's not exactly going to be the same quality or as your pre chemo or pre radiation hair. It's going to be a little lighter. It is going to be a little curlier. In fact, nowadays it is called chemo curls. You can see it on our screen right now. And I would say flaunt
Doctor,
them if they
sorry.
are.
I'm so sorry, but the presentation is not visible to us, huh? Just
Okay.
letting you know.
Since
Since a little while,
Okay.
since we spoke about the last bit of the discoloration and all,
Okay.
the presentation is not visible.
So I'll do one thing. Shall I?
Could you just reshare it again?
Yeah, stop share and reshare it again. Yeah, okay.
I think we were so engrossed in all of that, we didn't realize the presentation was not there
And this
until
is
you
nice.
mentioned it that it's there. Huh.
Okay. So
Now
they
we can see it. Thank you.
So we okay, but it is kind of not going ahead. Acha. So I think we were here, we were self inspecting, right? And we were on the hair now. So this here you can see chemo curls. It's got a nice name, and this is something I have added. So flaunt it while you have it is what I feel. If somebody has been always straight haired, why not enjoy those curly hairs for a little while, and then you are going to get back your normal hair. Of course, it will take time, but eventually your genetics are not going to change, so you will get back your own hair, but they will be a little thinner, curlier, and maybe a little lighter in color also sometimes during the immediate post chemo or the post radiation sort of therapy sessions. So that is one thing. And sometimes the other thing happens, like a few chemotherapeutic agents can also increase the hair growth. They can be also thicker and darker when they come back. So it differs again from patient to patient, and the type of chemo given, the type of radiation given. Here, one thing I want to underline, there are some patients who would come and tell me, Doc, I don't think my chemo has worked at all. I have not had any hair loss. And my friend who took the same agent 1 year back or maybe a few months back, she lost all her hair or he lost all her hair. But then this happens. This is a known factor that eventually, as every drug response, it has a different profile in every patient, how the patient responds to a particular drug. It also holds true in chemotherapy and radiation. With the same dose, same product, a person may lose all of his hair, and other person may lose partial or not. So it does not depend on the efficacy of a drug, or the radiation does not depend on whether you have lost your hair. It's just a side effect which some people get, some people don't get. It's like this. Some people take antibiotics very easily. They just pop in 5 days, 10 tablets without a problem. Whereas the others find it, they struggle because their tummy gets upset or they get acidity. So it's the same thing here. We have to understand that the efficacy is in no way related to the side effects. So what do we do with the hair? You maintain hygiene with a mild shampoo and conditioner. We always try to help out prescribing these mild things, or the best thing is to continue whatever you are doing with throughout the radiation. We should remember that post chemotherapy, if the scalp is still bald, just regrowing hair, that does not mean that we need not care for it. It also needs regular washes, maybe with a soap if not a shampoo, but I would still recommend the same shampoo and conditioner for a bald scalp also. Do not rush with hair growth concoctions. That I can understand totally, that you want your hair back. Everyone wants their hair back as fast as possible, and they want to use a lot of we have a lot of agents right now also, and some of them really do work. There is thyme in the market, there is rosemary, there's so many things in the market which definitely work, but there is a time to start all that, for the two simple reasons that, one, we don't know if we are allergic to, and second, what if we still are going to have that radiation related effects a little later? Then we will be compounding these with unwanted effects, and then we will all land up where we don't want to be, very in short. So let's not rush. Also, a lot of these hair growth products will again have antioxidants, which we don't want to use peri-radiation, before, during, and after. That's exactly the next point. Stay away from antioxidants, oral or otherwise, during the radiation therapy. Now, how do we then solve our problem? So there are ways. We have health growth accelerators in form of tablets, which have hair related vitamins, and there are hair growth serums, which may have peptides. These are growth peptides basically, and to be applied on the scalp or any hair bearing area for hair growth. In fact, the same can be used for beard also. And nowadays we have this eye drops, which are doing very well for eyelashes and eyebrow growth. How eye drops are used is, there's a story. These eye drops, when put for increased intra-auricular pressure, so people with high pressure inside their eye used to use this drop, and they found that their eyelashes started growing. So we are using this side effect for our regrowth. Obviously, we are not going to put it in the eye. We are going to take it, the eye drops, we are going to take it on our fingertip and use it on our eyebrows and eyelashes. And we are seeing wonderful results with that. And they are we are not seeing a loss of hair after stopping the products also. So the growth is good and it is sort of permanent. So hold on the salon visits. We don't yet know whether we are ready for it. So for 2 weeks at least, hold on doing anything to your hair, even if it's a minor blow dry, because none of them will do it without using a product, and that's exactly we don't want. Now, coming to nails. Many of you must have seen a few of these changes in either some of your friends, relatives, or your own. So what happens during radiation therapy is mostly a slow growth. Nothing is going to happen to the nails during radiation. What happens after chemo is these effects. So there could be discolored or bruised nails with brown, black, green color. This is mostly seen in the Taxol group of chemotherapy, docetaxel, paclitaxel, or the platins, the cisplatins, which is given in the head, face, neck patients once a week. Again, not all of them are going to have nail changes, so we have to bear that in mind. Sometimes the nails just become brittle and lusterless. Like they would just tell me, doctor, my nails just break often, more than what they used to. And there could be separation, like onycholysis, meaning the nail plate and the nail bed has a gap. So it's lifting up of the nails. This can happen in cases who receive cyclophosphamide or those alkyliding agents, which is doxorubicin or daunorubicin. These are the few chemotherapy agents which can cause this. Then this is an interesting thing. If you see here on the slide, you see this net-like pattern like a mat, crisscross. Now these are multiple horizontal vertical ridges, and these would actually indicate your chemotherapy sessions. What happens in that one day of chemotherapy, 1, 2, 3 days of chemotherapy, the nail growth totally stops. Obviously, it is a fast growing thing of our body, and every fast growing thing the chemotherapy will target. So that particular day, the nail totally stops growing, and that's why we see that ridge there. And then over a period of time, this gives us a pattern. That's how you see the ridges. And then ingrown toenails are very common because we are prone to more of infections, and a little ingrowth in the side cuticle will also give rise to inflammation. So how can we deal them is a lot of nice nail hygiene. Means when you wash your hands, you have to got to dry them. Generally none of us will ever do it, including me. We don't dry hands. We generally do this or use a tissue paper upper and we are done. But when we are undergoing radiation, or for that matter any cancer therapy, we always tell our patients to pat dry your hands properly, so there is no moisture in the cuticle. If possible, if you are having any nail problems, we should avoid or reduce water contact by use of gloves in unavoidable water work. A moisturizing cream, any moisturizing cream to the cuticles will work. There are a few which we could recommend. Something which has liquid paraffin, light liquid paraffin, or white soft paraffin, some ceramides. These are the ingredients we look for in any moisturizing cream. And that helps the cuticle stay intact. Once the cuticle is intact, nothing external will go in the nail easily, and then that will lead to prevention of infections. So massage with a moisturizing cream. Don't go for a nail spa. Don't go for manicure pedicure, because they'll over buff the cuticles. They will overdo it. They might do a good job. They might give you a cleaner nails than what your household remedies can help. But that will a little overdone. The job can create a problem because it creates a gap between your nail plate and nail fold, and then the splitting, the separation is more common. So hold on to your salon spa, nail spa visits also. Now, putting a nail paint is actually useful. So the same rule applies. Use a nail paint or a nail polish of the same brand that you are used to. In males, they can just use a sort of colorless sort of coat. What it does, it thickens the nail plate inherently, so helps the brittleness and breakage. So that helps. If you have to remove, use a acetone free nail paint remover. And sometimes what happens, it's just the habit, our fidgeting around the nail folds, or some people have this tearing, biting habit. That will definitely precipitate a lot of infections, inflammation. So that's something which is to be avoided for sure. This is just to remind you, hold on going to a nail spa. Sometimes radiation patients tell this to me, Doc, everything is okay. I just feel fatigued. I feel fatigued. I go home and I just want to rest, which is actually okay, which is normal. That is just an individual reaction. A lot of it could be due to anxiety also. But what we do to mitigate this is have a balanced diet. Drink a lot of water, because dehydration can lead to muscle pains and muscle, heaviness. And whatever exercise is allowed and recommended, that you continue doing. Otherwise, the stiffness sets in. Let's say a patient of breast cancer, if she doesn't move her arms the way they are told to be moved, then it will become stiff. Over a period of time, she'll say, oh, even this part feels heavy, but that's only because she has not moved it enough, kept the muscles supple. So importance of exercise, and of course rest also, because what happens a lot of time, patients are through surgery, chemo, which has kept them away from their duties. Now they feel this is just a 5-minute thing. I go in the machine, I come out, and kya hi ho jayega? I can go home and resume my duty. It's fine. It's not that you should not work. You do as much as you can, but rest is important more than your normal days. So there are 3 things what you could do to feel less fatigued, and that is diet, water, and exercise. Again, this is person to person. In fact, I have seen the most variations in this particular factor. It's a range from I feel nothing, dog, I can run a marathon, which they will not be allowed to, but they can, and to no, doctor, I can't do anything, I just want to sleep. So I think this is the time to listen to your body. Don't make assumptions. Don't make your body do what it doesn't want to. Just follow what your mental state tells you and do accordingly for best results. So post radiation means after a fortnight to forever, what can be done? So after a fortnight, first thing you do is we confirm what needs to be continued, what needs to be stopped. Then we don't want to resume everything together. Like we had a patient who, after the 15th day, the 16th day, the workout was in place, the weights were in place, the kitchen work was in place. So then it caused a friction, a little redness. So we don't want to resume everything together. Take it slowly. Maybe start just the kitchen work if that's important. Maybe start the walk if that's important to you. So start one by one over a period of time rather than resuming everything together. Then we teach massage. A lot of patients here I must have already taught, our rehab team, sometimes Dr. Prasad himself will teach. So the massage is important for keeping the skin supple and soft over the long run. And this is exactly what works in that long-term effect where I told you that sclerosis or fibrosis, where it becomes a little tight to feel and stiff, the skin becomes stiff, or the one breast looks a little different than the other breast in size. That's only because it's been pulled inside. So when we massage regularly, that suppleness is maintained, that muscles are also supple and the skin is supple. The elastin collagen kind of gets remodulated with the massage. So that helps in the overall long-term cosmesis of a radiated skin. You can, if you want to discuss your concerns of pigmentation, change in structure or the hair. Why am I saying discuss is, see, all this is going to come back to normal over a period of time. So if you ask me, doc, whether I do need an intervention, no. Apart from moisturizing your skin thoroughly and massage, there is nothing which is an absolute requirement. Then it is an individual choice. There are some patients who say, doc, I've done enough. There's been surgery, there's been chemo, there's been radiation, there have been radiation creams, and now I want to just take it lightly. I am not bothered about the cosmesis. Good enough, fair enough. The skin is going to come back to normal without our help also. But it's going to take its own time. So the only difference is we may just prepone the getting back to normal. So it all depends on the personal choice. So if you want to, you can discuss about these concerns, and then we have various protocols and various things that we can give to address those issues. So what you specifically discuss with your skin specialist? When can you get back to your normal clothing? If you have to wear those, inner wear is generally disallowed in breast cancer patients. So when can you resume that? If somebody has to work in formal clothes only, so around the neck, the collar, shirts, when are they allowed? Or any fabric which may be a little not too comfortable on the skin, but someone has to attend a function maybe. And so when those can be resumed. So depending on your skin at that point of time, we may also tell you, okay, this can be done after 10 days, this can be done after 15 days. So we sort of, work up a timeline on when the do's and don'ts dissolve one by one, and then you can get back to normal gradually. Resuming household duties we just talked about. So what happens is, being in front of the gas also creates a sort of a heat sometimes. It may also give rise to sweating, and that may give rise to friction. So depending on how your skin is, we may have our opinions on when can you, resume all these duties. Of course, salon procedures, spa procedures, there are dates. We give a timeline. After this, it is allowed. Hair color is very important, because sometimes patients feel hair color though is on the hair. What will happen to my skin? But there is a condition called radiation recall. Radiation recall means nothing has happened to the radiation skin during the radiation. After the radiation is done, when a person uses the hair color on the head, the same hair color which he or she has been using all these years, even if it's reused, and sometimes the skin on the radiated side becomes red, and this happens. So it is like a delayed hypersensitivity or a delayed reaction or an unmasked allergy maybe. And because that skin is that nazuk type of skin, only that reacts and the head is still okay. So for all this, we take a while. We take about 3 weeks per se in hair color, in terms of hair color. And we would like to use you to use an organic hair color without chemicals for obvious reasons. So we may have, some product suggestions for you. Or even if you want to go back to your own hair color, which has been good in the past, there is a timeline. We set up about 3 weeks later. So what my point is here, these are the points we discuss when we meet towards the end of our sessions. razor shaving. So when it comes to males shaving their beard, there are do's and don'ts. We don't allow razor during the radiation, and a few days after that, trimmer is allowed. And sometimes what happens, patients have to do something because, say, one side the radiation is there, so that hair is going to be thin and slow growing, and the other side is normal. So for getting that symmetry, they have to do something. So razor shaving is allowed a few days later. Till then, trimmers are allowed. So all these things get a timeline from us. That doc, tell me the time, the date from which I can start. Now, hobbies like swimming, running, all this involve a lot of sweating sometimes, contact with chlorine from the swimming pools. So all this also need to be discussed about when your skin will be probably ready to take all that. Long-term care in terms of, now I'm taking in terms of years. So moisturizer and sunscreen is a must, because all radiations will make you a little sun sensitive in that area. So sunscreen, and in any case, every person should use a sunscreen, is what every dermatologist will tell you. And moisturizer to keep the skin supple. Sun protective behavior in addition to the sunscreen use, like whenever you're on the beach or an outing through the day, it's useful to use your caps with broad rims, a good sunscreen, full covered clothings. Massage and exercise is a long-term commitment. Twice a day massage in the particular steps that we follow. Avoid smoking is very important even in the long term, because it kinds of have a lot of vascular changes in the skin, which will help us. So the vascular changes might lead to a lot of post radiation long-term problems. So to avoid them, we should avoid smoking. Balanced diet, healthy lifestyle is a no-brainer. We all know that it is going to go a long way in how our health and skin are in general. And weight maintenance, it's been seen that overweight individuals tend to have a lot of pigmentation problems also, because of course their hormones are a little more stimulated, and a lot of other problems also. So weight maintenance is also one of the clean lifestyle management issues that we need to look at. Avoid over anxiety. When we say all this, we are just kind of sensitizing you to it. We don't want to invoke a fear in you. So it's not that we can't socialize. We can socialize following all the norms. There are people during the radiation, they attend parties, they attend social functions with all the restrictions, the little restrictions of the clothing. As I said, some cheat sheets which we can tell them, and so how to protect our skin during the time and after that. We can attend family functions. We can really dress up, go out. We can do light exercise also. Some people are very much used to their walks, so we tell them, take care, don't do it during the daytime, maybe the night time when it is cool and pleasant and no sun. So there are ways and means to go about your normal routine. Things that you like to do, we could still do, but with
Doc,
the
I
proper
am
guidance of hows and whats.
really
Avoid a
so
careless attitude,
sorry
of course.
to interrupt, doctor, but I think we have some of the questions in the chat box also, which we could
Sure,
take up very
sure, sure.
quickly before we end today.
Yes, 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 definitely.
Thank
So, okay, I think, okay. So, regarding monsoon, we just have to be clean and dry, avoid fungal, viral infections. Viral infections, crowded places we have to avoid, because if we get viral infections, then we have all the problems, skin including, and avoid mosquito bites for dengue and malaria. So, this is for monsoon, and this is something, ask us, don't stop from asking. And this is something I don't want to miss. Your caregiver, your attendant is very important. Spare them a thought. They have been living it with you. So this is for those caregivers who have been there with you for your every visit here. Okay. So spare them a thought, though you can take them for granted a bit and let them pamper you a bit. Thank you. Yes. Come, let's go ahead with the questions.
Uh, my name is Manoj Jain, and I think my question is slightly different from what you have just presented in the sense
No
my
problem.
radiation was completed in last week of June with Dr. Prasad Dandekar,
Okay.
and it was coupled with the chemotherapy sessions where I underwent the cisplatin doses every week. And even before the start of the chemo and radiation, in my case history, I have mentioned that my skin is sensitive. So what I am asking you, Dr. Rita, is that my skin issue is not exactly directly related to the radiation. But in one of your slides, all those symptoms which I am facing, you have mentioned that. Means I get a tremendous itching sensation And when I do the itching, that part becomes red.
Okay.
And sometimes skin little bit it goes up actually in that area. And except for face, it randomly happens all over the body.
Correct.
And it's just not going. And you know what happens when I take a tablet of cetirizine, 10 mg, it gives me solid relief. And
Relief.
next 4 days, I will as if I have no problem. But by the end of the third or fourth day, when it
It's again.
wane off, I will again start having the itching.
Yeah.
If I control the itching, then redness will not happen.
Okay.
But beyond the point, I am not able to control. And another important thing I want to tell you, radiation site is absolutely not impacted with
Not
it.
impacted.
My
Correct.
radiation was done in the pelvic area because it was a urinary bladder cancer.
Okay.
It was done there, and I underwent 33 radiation sessions.
Right.
So it is the overall thing.
Correct.
I don't know what to
So
do. Or
I
should I
think I was
continue?
just going to come to that point that, sir, I think your this problem, particular of itching, and is
Yes,
no way related to what sort of pathology we have faced and what treatments we have got for that. You
correct.
would have got it in any case, as any normal aging person would get, some more than the others. So what we are dealing with here is mostly a dry skin or a little, mild allergy problem. So so many of my patients are on this. Cetirizine once in 3 days gives them relief.
Correct.
There are, of course, a few tablets which we can give for a long term to kind of suppress these things, but a lot of patients do prefer to take that one cetirizine once in 3 to 4 days, and they're absolutely fine with it. What I can recommend here is a daily moisturizer, which will go a long way in not getting dryness of our skin.
Okay.
And pick up something with light liquid paraffin, soft paraffin, ceramides. There are a lot in the market. Even our normal Vaseline and stuff will do, but use it regularly, not only when you feel dry. And 50% of your problems, sir, I think will be solved only by this
By
moisturizing
applying all over the body, that
all
after
over the
bath.
body, all over the
Okay.
body, and use a moisturizing soap or a body wash also.
But my
Don't
one
use.
pointed question is there. Cetirizine, if I am taking once in 3 4 days, in long term, is it going to harm in any manner or nothing much is?
It's not going to
Because
harm
it
you. Of
gives
course,
me
we wouldn't
instant result.
recommend
You
anyone
know,
ourselves. We would like to help and attempt stop it, but no. So many of my patients are doing that, and
because the moment I take within an hour, I will feel as if this problem was
magic.
not there at all. Magic.
Correct.
So that's
Yes.
all. Thank you so much. Yeah.
You're welcome, sir. Yes.
So, Doctor, I think we'll just take one more question. There's a question in the chat box. Now, I'm sure we've answered quite an extent of it, but would still like to reiterate that, hi, doctor, I wanted to inquire about hair color, and for hand nail, my nail breaks very fast. So I think we have covered it
Yeah.
already to a great extent, but doctor, would you like to add like a few bits
So,
to it still?
so just 2 points. One is your hair color can be the same one you have been using for years together. Resuming it would be dependent on when our radiation is getting ended, like generally 3 weeks after radiation. And if we choose to not use a chemical color at all, then there are a lot of non-chemical colors available in the market that we could suggest. Even if you can buy it over the counter, doesn't matter. And for the nails, it just is a long-term therapy of managing your moisturizer around the cuticles, reduce your wet work to some extent, and take oral biotin. So we have a few brand names which are pure biotins. They're not a mixture of vitamins or anything. Biotin is very helpful in nail health. It is available naturally in eggs and a few green leafy vegetables also. So one who doesn't want to take a tablet can increase the amount of leafy dark green vegetables and general vegetables and eggs in their diet to get biotin. I hope that answers your question. Am I audible, Nezabi?
Yes, doctor.
Okay.
I think it answers the question perfectly.
And anything else, dear?
Uh, no, I think
Thank you.
we have lovely comments in the chat box
I
saying
saw that just.
Jyoti is saying thank you very much,
I'm
and I
so
must tell you
happy.
that though we've been
And
talking about this, yeah,
so
and
generally,
I think
whoever
this is
has
a
seen me even
conversation.
once has my number, and they know they can directly contact me. But even if you have not seen me, and you can just approach the hospital, or Mezbin can really, we can type it here also. You can just message me anytime you want, and as soon as possible, whenever I see that, I will just, answer your query.
Thank you so much. Thank you for being so hands-on. And also, we do talk about this quite often within our units about the importance of skincare and everything. But I think today I definitely learned a few more concepts. And I'm sure that our participants too had a great time understanding so many good questions. And I think that's एक होता है ना एक classic landmark sign कि when there are lesser questions to ask, the easier it is that everybody's understood everything.
Yeah, hopefully.
Yeah, yeah.
No, and if they
All
feel
right.
like they can ask me. Yeah.
Lovely, lovely. So if there are any questions that we have right now, though we are winding up because it's 1 o'clock and we don't want to keep Dr. Rujita for a longer period of time. I'm sure you have a very busy day ahead. But if there are any questions, you can email it to us. You can reach out to Dr. Rujita, or you can put it up on our WhatsApp group and we'll pass it on to her and
That's
we'll get them answered as soon as possible.
Thank you for
Okay.
this opportunity, Mezabeen, Dr. Prasad. I'm so happy to be able to connect with this group. It's always been a pleasure. Thank you. Thank you so
Thank you
much.
so much. Thank
Bye-bye.
you.
Have a good day.
Bye-bye.
Have a nice weekend ahead.
Thank you.
Bye.